Hi, I am Peter Gloviczki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. Thank you for viewing this video on the highlights of some excellent papers that we published in the November issue of the JVS. This month, the Editor's Choice article is also our CME article. It's entitled, "Last neurologic event is associated with risk of in-hospital stroke or death after carotid endarterectomy or carotid artery stenting." The study was authored by Dr. Pavlos Tsantilas and colleagues from Munich and Göttingen in Germany. This was a secondary data analysis of the nationwide German Statutory Quality Assurance Database. Data of 144,347 patients treated by carotid endarterectomy and data of 14,944 patients treated with carotid artery stenting were included in this study. In patients treated with carotid endarterectomy, the raw risk for any in-hospital stroke or death was 1.4% in asymptomatic patients and 3% in symptomatic patients. In those treated with CAS, the risk was 1.7% in asymptomatic patients and 6.1% in symptomatic patients. Regression analysis revealed that increasing severity of the last neurologic event was associated with an increasing risk of any in-hospital stroke or death in patients treated with both CEA and CAS. However, the risk of any stroke or death did not significantly differ between asymptomatic patients and patients who presented with hemerosis fugax before the procedure. The next paper I would like to present is entitled "Results from a Prospective Multicenter Feasibility Study of Zenith P-branch stent graft." This paper was authored by Mark Farber and colleagues from 5 aortic centers in the United States. To repair asymptomatic juxtarenal and pararenal aortic aneurysms, the authors used the off-the-shelf P-branch endograft that incorporates a celiac scallop, superior mesenteric artery fenestration, and 2 conical-shaped pivot renal fenestrations in 30 patients. Technical success was 93%, 30-day mortality was 0%. Renal artery patency at 2 years was 88%, and no patients required dialysis or developed mesenteric ischemia. 1 out of 3 patients, however, underwent secondary procedures to treat renal or mesenteric artery lesions or to treat endoleaks. The study ultimately supports the safety, feasibility, and early efficacy of the off-the-shelf Zenith P-branch device. The next paper I'd like to bring to your attention is on the differences in patient selections and outcomes based on abdominal aortic aneurysm diameter thresholds in the Vascular Quality Initiative. This was authored by Douglas Jones and colleagues from Boston, Massachusetts and New York, New York. Of 22,975 patients who underwent elective EVAR, 91% had small and 12% had large aneurysms. 1-year reintervention-free survival was significantly better, 92% in those who had small aneurysms versus 82% for those who had large aneurysms. 5 years overall survival was also significantly better for those who underwent repair of small aneurysms. Cumulative survival up to 5 years was significantly better in small than in medium, and in medium than in large abdominal aortic aneurysm patients. Although the risk of rupture of small abdominal aortic aneurysm should always be considered, in this study, aneurysm diameter was independently associated with reinterventions and mortality after EVAR, suggesting that aneurysm diameter likely has an important clinical effect on outcomes. The final paper we would like to introduce to you is entitled Benefit of Multidisciplinary Wound Care Center on the Volume and Outcomes of a Vascular Surgery Practice. It was authored by Dr. Alicia Flores and colleagues from Stanford and Sacramento, California, and Hanover, New Hampshire. In this study, a prospective institutional database was used to identify patients who underwent intervention before and after the opening of an affiliated wound care center, staffed by vascular and plastic surgeons, vascular medicine and infectious disease physicians, and a wound care nurse. Introduction of an affiliated outpatient wound care center resulted in a 64% increase in lower extremity revascularization, with significant increase in surgical debridements and infrapopliteal endovascular interventions. There was a significant decrease in major amputations from 8.8% to 5.5%. The authors concluded that integrating vascular surgeons into wound care center may result in a synergistic system that promotes more aggressive and effective limb salvage. These were 4 of the many excellent papers from the November issue of the JVS. You can download them free of charge at www.jvascsurg.org. Enjoy reading all JVS journals and let us know if you have any questions or comments. Thank you for watching, and see you next time for the highlights of the December issue of the Journal of Vascular Surgery.